Which embryological layer is primarily responsible for the formation of the neural tube? A. Endoderm. B. Mesoderm. C. Ectoderm. D. Neural crest only. Answer: C. Ectoderm. A sacral dimple is often benign, but which of the following features increases the suspicion of an underlying closed neural tube defect? A. The dimple is located within the gluteal cleft. B. The dimple is less than 5 mm in diameter. C. The dimple is located more than 2.5 cm above the anal verge. D. The dimple has a visible base. Answer: C. The dimple is located more than 2.5 cm above the anal verge. What is the term for the total failure of the neuraxis to close, resulting in an open brain and spinal cord? A. Iniencephaly. B. Craniorachis. C. Exencephaly. D. Diastematomyelia. Answer: B. Craniorachis. Patients with spina bifida are frequently prone to executive dysfunction. This typically manifests as difficulty with A. Long-term rote memory. B. Basic sensory perception. C. Planning, organization, and task initiation. D. Simple muscle reflexes. Answer: C. Planning, organization, and task initiation. Which classification system is most commonly used to describe the functional mobility of a person with spina bifida? A. Glasgow Coma Scale. B. Hoffer classification. C. APGAR score. D. NYHA class. Answer: B. Hoffer classification. Diastematomyelia, a condition sometimes associated with spina bifida, is defined as A. A complete absence of the spinal cord. B. A longitudinal splitting of the spinal cord into two hemichords. C. The presence of two separate brains. D. A herniation of the cerebellum. Answer: B. A longitudinal splitting of the spinal cord into two hemichords. What is the significance of detrusor sphincter dyssynergia, DSD, in spina bifida? A. It causes the bladder to become overdilated and thin. B. The bladder muscle contracts while the sphincter is closed, creating high pressure. C. It leads to the inability to feel thirst. D. It results in persistent low blood pressure. Answer: B. The bladder muscle contracts while the sphincter is closed, creating high pressure. In a child with myelomeningocele, which muscle group is typically the last to lose innervation in a descending lesion? A. Hip flexors, L2 L3. B. Knee extensors, L3 L4. C. Long toe flexors and intrinsic foot muscles, S2 S3. D. Deltoids, C5. Answer: C. Long toe flexors and intrinsic foot muscles, S2 S3. Which of the following is a potential late complication of a ventriculoperitoneal (VP) shunt? A. Inguinal hernia. B. Improvement in vision. C. Increased hair growth. D. Decreased need for folic acid. Answer: A. Inguinal hernia. What is the conus medullaris? A. The uppermost part of the brainstem. B. The tapered, lower end of the spinal cord. C. A type of brain tumor. D. The membrane covering the spinal nerves. Answer: B. The tapered, lower end of the spinal cord. Which skin condition is a major risk for adults with spina bifida who use wheelchairs? A. Melanoma. B. Pressure ulcers, decubitus ulcers. C. Eczema. D. Psoriasis. Answer: B. Pressure ulcers, decubitus ulcers. Spina bifida cystica is a collective term that includes which two conditions? A. Occulta and meningocele. B. Meningocele and myelomeningocele. C. Anencephaly and encephalocele. D. Scoliosis and kyphosis. Answer: B. Meningocele and myelomeningocele. What is the primary pharmacological treatment for an overactive, spastic, neurogenic bladder in spina bifida? A. Antibiotics. B. Anticholinergics, e.g., oxybutynin. C. Diuretics. D. Beta blockers. Answer: B. Anticholinergics, e.g., oxybutynin. What is the primary purpose of AFOs, ankle-foot orthoses, in spina bifida? A. To improve hearing. B. To provide stability, prevent contractures, and assist with ambulation. C. To treat hydrocephalus. D. To monitor heart rate. Answer, B. To provide stability, prevent contractures, and assist with ambulation. Which of the following describes the Arnold-Chiari-2 malformation? A. Downward displacement of the medulla, pons, and fourth ventricle through the foramen magnum. B. Upward herniation of the cerebellum into the midbrain. C. A cyst in the fourth ventricle only. D. Complete absence of the cerebellum. Answer, A. Downward displacement of the medulla, pons, and fourth ventricle through the foramen magnum.